couple of days, weeks actually, the Chikungunya virus that has been wreaking havoc in Mandera County threatens to spin out of control. The disease, which has affected half the health workforce in the county, spares none. The health sector was already grappling with the cholera outbreak in the same region, and now Chikungunya. The county is overwhelmed. Just what is this viral epidemic? Let's uncover it in the coming story prepared by Dr. Mercy Koreid for us.
Hussein Salah's cautious walk tells it all. His posture speaks of a man whose health has seen better days. Each movement ordinary to you and I causes him unbearable pain. He narrates to us what he has been going through.
Kulala wezi, kutembea wezi, kukula wezi, mkojo unabebwa na basin. Sasa mimi siku 4 siona choo, mimi nabeba mkojo wangu nabebwa, leo ndo nimesemboa usilale, tembea ndo utabata nafuu kidogo.
He is one of the many residents of Mandera who have been affected by the Chikungunya. Residents here have a terminology for it, one not so far from the Kimakonde people's definition of Chikungunya.
Kwa Kisomali inamaanisha just some breakdown of the system, the joints. The joints feel like shrinking. When they shrink, most of the joints, they shrink as you feel this disease.
Chikungunya is a viral infection spread by mosquitoes of the Aedes species. It was first described during the outbreak in southern Tanzania in 1952. It is no new disease in Kenya, being the third commonest after dengue and Rift Valley fevers in their class of viruses.
We had another outbreak of chikungunya in Kenya after that lull in 2004 in Lamu, and it affected Lamu and Kilifi and parts of Mombasa.
The infection has a short incubation period of between 4 to 8 days. Those infected will experience an abrupt onset of fever, debilitating joint pains which may be prolonged even for weeks, rash, muscle pains, headache, nausea and fatigue. Specific laboratory tests are required to confirm the diagnosis.
We have diagnostics for detecting whether somebody is having antibodies to the virus. They've been infected and they are responding by generating, eliciting antibody response. So we look for the antibodies in the blood, and we also look for the actual virus.
Though not fatal, no specific antiviral drug treatment exists for this disease. Treatment is directed at relieving the symptoms, including the joint pains, using optimal pain medication and fluids.
There is really no antidote to the virus. We have no vaccine for the virus, and in fact, we have no vaccines for many of these viruses.
The World Health Organization warns of these emerging and re-emerging viral diseases that pose a threat to public health in this century. What then do we need to do to prevent or control this infection?
People are advised to make sure they don't create breeding places for mosquitoes.
In the background of a health system that is often plagued by inadequate funding and limited personnel, Kenyans wait to see the actions that the relevant government agencies will take to contain not only chikungunya, but other highly infectious and contagious diseases. Nicholas Wambua, KTN News.